Okay, this isn't about religion. This is about health. And in lots of ways, we work with gods, and they're the top of the tree. Well, sometimes they're wrong. So what we need to do is to empower the whole team. What we need are the angels. And that's the people I'm trying to empower. And what we need is these angels to go into care homes. So this is specifically what this video is about. So this is the website I made called careforteeth.org. And more recently, I did a course on AI and I made an assistant. So there are about 6 assistants on the dentalhealthservice.org, and one of them is this one, the old assistant. So if you go onto it, it'll show how it works, and it works. And the thing about it's what's called an LLM, large language model, and all of the detail within it is details that I've made over the years regarding what you can do and you can't do maybe in care homes. The thing is that if you actually look at the dentalhealthservice.org website and the 3 things on the top that are extremely relevant to care homes, they're extremely relevant to everybody. What I'm trying to do is to empower the whole of the team, because actually, from what I can understand, following my visits to care homes, giving them cameras, giving them scanners, giving them toothbrushes, and asking, I think dentists need to go there in less than 10% of the time. Trained dental nurses can go in, and that's what we can do. We can do asynchronous checkups or even synchronous checkups, so that when a dentist is required, then they go in knowing what they need to do. They'll have the equipment with them, and it saves time and money for everybody. So ultimately, what we need to do is to get people to adopt dental practices. But as I've said before, there's a bit of a fear index in if you're going to get into trouble with the GDC. And this is ridiculous. So what we're saying is we can't help these people because we're worried about the trouble we're going to get into for the governing body that is actually the thing that is meant to improve access. It's a ridiculous situation. So anyway, I learnt this yesterday using CapCut on my iPad, and clearly this is my first attempt. But I hope you find it useful. And then at the end of this, I'll just put a few little bits on. But you go onto it and try it out. It does work. So take a look at this. It's based on some very successful businesses that have a very lean management structure, which is what we need for the health service. Go onto the websites and sign the petition and register, and that way we can help improve all our well-being.